Is Obamacare finally working the way it's supposed to? Or are there still problems that make it difficult for Americans to participate? Find out as we examine Obamacare again right now on It's Your Call. The Obama administration has finally gotten its Obamacare website up and running, somewhat, but does that mean the idea behind it is a sound one, or is it doomed to fail? Hello everyone, it's good to have you with us. I'm Lynn Doyle. Welcome to Obamacare Take 2. First, there was the October 1st deadline that said anyone who didn't have insurance had to have it, but when people tried to sign up, the website launch was a bust. Then there was an overhaul of the system and a new deadline of November 30th to get it up and running. Now it is up and running and running and running, but for many, it's still not getting anywhere. Problems still exist despite the president's assurance that some 17 million people are already on board. But Gallup estimates that 17% of Americans are currently still without health insurance, and those who remain unable to comply with the ACA mandate of getting or having insurance makes this whole thing sound like a proverbial catch-22. We're going to ask those questions to our guests this hour, including Terry Rivera, who is the Vice President for Mission and Community Health at St. Mary Medical Center in Langhorne, Pennsylvania. Her role is to educate people about the health insurance exchanges and to enroll people in them. Also with us is Dr. Richard Harris. He is a professor of political science and public policy at Rutgers Camden. Thank you both so much for your time. We welcome you to be part of our conversation. If you have questions or comments throughout the show, start to email me at lynn@lynndoyle.net. I'm going to turn to Terry first and welcome her back to the show and ask if you can give us a status update. Where are we now compared to where we were when we did this show 6 weeks ago?
Well, right now we are definitely seeing progress. We have enrollment centers out in the community. Folks are coming in. They are able to get on the website. About a week ago, they were able to actually look at the plans side by side so that they could make their determination. I will say that there are still some times when you get booted off the website, but by and large, we've seen a significant improvement, and we're starting to see people coming back now saying, I'm ready, let's try again.
What kind of response are you getting from the public? Are they very overwhelmed? Are they discouraged? Are they negative about the Obama administration as a result of this website glitch?
No, actually, most of our centers are in areas where there are a lot of uninsured folks, so actually they're very excited and happy because for the first time, many of them in many years are going to have health insurance. They're going to get some assistance in paying for it. It's something that they've been waiting for. By and large, we are seeing appreciation and we're seeing people excited about going and getting it. Not saying it's always easy, but they are excited about getting it.
You know, that's good to hear. I'm glad that people are welcoming this opportunity despite the political aspect to the issue, which we're going to talk to the professor about in just a moment. But just to recap, can you give our viewers who still might not have grasped what the concept behind the ACA known as Obamacare, what it is, what it's meant to do?
Well, the marketplace, or the exchanges as they're sometimes called, really, I kind of liken it to a street we have in Bucks County where all the car dealerships are, Route 1. And people go and they go from one car dealership and look at what they have there. They go to the other car dealership and then they think about it, compare, and they purchase the one that best fits their budget. And that's really what the marketplace does. It allows you to go on, look at all the healthcare plans. In my area, we have two insurance companies, and they look at them and they say, okay, what's going to be best for me? And there are basically four types, sort of like 4 different types of cars. There's 4 different types of plans, and each one has a little bit of a difference in them.
This may sound like the most simplistic question ever, but we've actually gotten viewers who have written to us and asked it. So I'm going to put it out there for you. If you don't have insurance right now, typically it's because you can't afford it. So how are these same people expected to pay for insurance that they find on the marketplace or the so-called exchange?
Well, there's financial assistance. It's basically in 2 buckets. The first bucket is tax credits. That's a fancy word for saying that if you meet the financial income, you're going to get help paying your premium every single month. They're going to the government will send money to whichever insurance company you pick, and they'll help you pay for the premiums. There's also what's called subsidies. And if you qualify for that, they will actually you will receive financial assistance to pay for things like copays and deductibles. So if you're between 100% of poverty and 400% of poverty, 100% of poverty is $11,490 a year for an individual, and then you can make as much as, I think, $45,000 at 400%. You're going to get some financial assistance.
Now, see, that sounds great, and I'm sure the people at home are saying, sign me up, I love it. But Professor Harris, you think that it could be a logistical nightmare to actually implement it?
Well, I think the implementation nightmare doesn't really have to do so much with people understanding what the numbers are, but really it has to do with the fact that once you get on the exchanges, once you start walking down the street to compare the car dealers, that the car dealers and the customers both have accurate information. So if you go to buy a car, the car dealer needs to know what your preferences are. They need to know about your credit rating. So insurance companies need to know accurate information about what you're looking for and also what your health history is, so they can slot you into plans and give you a number, a price that you can actually compare. And it's actually the development and exchange of that information via the website that's going to be a bit of a challenge.
And it is actually being done through the website now? The consumer is providing the health
Right.
information, and then the provider of insurance says you need this kind of coverage.
Well, not that you need this kind of coverage, but once you tell the insurance company what your background is, what your personal information is, and what kind of coverage you want, they can give you a price that's going to accurately reflect what you want. So unless they know what you're looking for and what your risk profile is, they can't give you a price.
And the price is dependent, again, on how much you make as a family or as an individual. Is that right?
Not the price of the insurance. What's dependent on your income is how much financial assistance you'll get to pay for it.
Okay.
Yes,
And
yes.
and another question that has come through that, again, might seem like it's a kind of a simple one is, if you don't have the money to be paying for insurance right now, even if you get the subsidies, do you have to put the money out yourself, or is it just kind of shuffling paper from one side to the other?
Well, there is a penalty if you choose not to accept insurance. So that's pretty clear that you will have a penalty at come tax time. I'm not quite sure.
Do people put the money out themselves, or do they get the tax credit at the end of the year on their tax returns? I think that was the way the
Yes.
question was
Yes.
was phrased.
You can choose either way. You can say, if you qualify financially, you can have the government send the insurance company that money that you're entitled to help you pay for the premium every month. Or you can wait till you can pay the premium every month and wait till the end of the year and get it as a tax credit.
So, for example, if you can't afford $100 a month for insurance, you should probably be on another type of assistance, like Medicaid or Medicare? Or is that the question that's up in the air?
Yeah, well, I mean, you actually raised another important point about implementing the Affordable Care Act. It's really important to understand that the Affordable Care Act is really much more than just the exchanges. The exchanges actually deal with about 5% of the total insurance market. Most people still get insurance through their employer, and then there's a significant piece of the Affordable Care Act that's linked to an expansion of Medicaid. And if people are in a category we would call the working poor, the Affordable Care Act covers them through Medicaid, not through the exchanges. The problem that we're facing now is that not all states across the country have decided to opt into the Medicaid program. So if you're in California or Kentucky or New York, you qualify for Medicaid assistance. If you're in Texas or Oklahoma, no, that Medicaid option is not available to you.
So as confusing as it was before, now you have to know which state you're in and whether they are involved in the expanded Medicaid or Medicare program.
Yes, and I think that speaks to one of the major challenges of implementing the Affordable Care Act. So unlike a program like Medicare, where it's very simple, the government is going to provide insurance payments if you meet certain criteria, the Affordable Care Act requires or assumed that states would collaborate in terms of setting up exchanges, so the federal government wasn't really prepared to make its exchange available in as many states as it had to. It also depended on the states accepting the Medicaid expansion, which is a really good deal financially, right?
Right.
And so the Obama administration, I think, never in their wildest dreams imagined that so many states would opt not to go into the Medicaid expansion.
All right, so having said all of that, what kind of coverage can people expect to get when they go on the exchange and they go down Route 1 and look at all of the different car dealerships? Do they actually have a lot of options, or is it very limited?
There are a lot of options. There are 4 different plans: bronze, silver, gold, and platinum. So every insurance company that comes on the exchanges should be offering those types of plans. In the bronze plans, for instance, the plan will pay for about 60% of your medical costs, and you pay for 40%. In the platinum plan, the insurance will pay for 90% or 90% of the bills, and you'll pay for 10%. So there's different options. So you need to look at your health status. Do you go to the doctor a lot? Are you very healthy? And those are the kind of things that you have to consider when purchasing.
So when you're going up and down that boulevard, you're wondering whether you want a Kia or
Yes.
a Jaguar. I have to take a quick break. But when we come back, we want to ask you what you think about all of this. Are you still confused by Obamacare? Do you have questions or concerns about what it is and what it will cover and whether or not you should be eligible for it? And have you tried or maybe successfully signed up and are willing to share your story about it? If so, please email me during this break. It's lynn@lynndoyle.net. You can also find us on Facebook. You can follow me on Twitter. I am at Lynn Doyle TV. We'll be back right after this. Welcome back to It's Your Call. I'm Lynn Doyle, and our topic is Obamacare Take 2. As you know, we talked about this topic when it first launched the website back in October, and as you've, I'm sure, heard, at some point there have been some glitches with that website. What we're trying to do now is to give you a status report on where you are in terms of the repairs that they've made to the website and what you need to know if you want to go on it and sign up for the so-called Obamacare. The topic has certainly gotten the interest of our viewers, I have to tell you. We have gotten so many questions, so many calls, so many comments on my Facebook page that we selected a few, and we're going to ask our guests if they would be so gracious as to try to help a few of you all out. This viewer tells us a very sad tale. First, she says, please let me apologize for my spelling. I've had a stroke and sometimes I can't remember how to spell a word. My husband is disabled and has Medicare. My daughter and grandson have Medicaid. I have no insurance, no income, zero, none at all. I went to the website and they calculated me with no income that I would still have to pay $6,000 a year. My husband only gets $7,900 a year. How am I supposed to pay for this? Please don't tell me to try to get Medicaid because I've already done so. I've been told that I'm not eligible for it. I'm 57, I have diabetes, nerve damage, diabetic, neuropathy, osteoarthritis, help, help, help. Also, I live in South Carolina, if that means anything. It's a sad, sad story.
It is. And
can we give her any suggestions? I know you're in Pennsylvania based, but just the idea that here she says she has no income and they're calculating it would cost $6,000. That was what I was asking you earlier. If you don't have money, should you be in another program other than Obamacare?
Well, that's where I think Medicaid expansion would come in. I don't know if South Carolina has expanded. They have not expanded Medicaid. So the law was created so that that portion of folks, the very poor, would be able to get Medicaid.
Yeah, I think this raises a really sad but important point here. The fact of the matter is that the way the Medicaid expansion was set up, if the state opts for a Medicaid expansion, which would have covered this woman, the federal government will cover 90% of the expansion costs, and the state would only be responsible for 10%. And that percentage would go down over a 5-year period, but the federal government would be subsidizing this expansion. And I think the sad answer to this woman is that in some states, the decision not to participate in Medicaid expansion is really driven by an ideological opposition to this expanded role for government.
But even if they don't participate in the expanded version of Medicaid, wouldn't the original version in some way be helpful? Isn't that why it's there, to help people who have nothing?
If she didn't qualify under the standard Medicaid, and she, I take her at her word that she tried and she was told that she doesn't, she wouldn't qualify. She would be one. She is a, Exhibit A, Your Honor, of why Medicaid expansion was put in place, was to cover part of the uninsured who were just without options.
Well, she also seems like she's a living example of why Obamacare was needed, or according to the Obama administration. I mean, she's the one I would think would need the help, not someone who's even making $25,000.
And when you're applying for Medicaid, it's your household income. I don't know the situation, but maybe her husband is receiving some funds from the
said
disability.
$7,900.
So that puts her out. In Pennsylvania, if you make more than $2,872 and you're not working, you're not eligible for the Medicaid that's currently existing.
Right, I can see why consumers are confused and very frustrated as well. We have another question from Sherry Lynn. She says, I've exhausted my unemployment and I have no income. I depend totally on my husband for support, who is now also on unemployment. We get no welfare or medical by choice. It is our religion to depend on God to meet our needs. But here's my question. What about the fines that are associated with choosing not to take Obamacare? I believe this is the greatest controversy. That kind of speaks to a policy issue, doesn't it?
It does. Well, it certainly is a controversy, but the short answer is the fines are put in place because the whole underpinning of the Obamacare program is to change people's incentives so they can participate in these pools. One of the problems with the people understanding the Affordable Care Act is they're looking at it from their particular perspective. What am I paying out of pocket? But the fact of the matter is, if this woman got sick and had to go to a hospital, the hospital would be obligated to provide coverage for her, and those costs would be passed on to someone else.
This is a policy issue that could probably take up an entire show, and we can't do that. But she mentioned that they don't believe in healthcare; they believe in prayer and her faith, and I'm sure that there's got to be some way to cover that in the ACA, just like people who don't want to vaccinate their kids because of religious beliefs or something.
To my knowledge, you can't opt out. This is just like driver's insurance. Everybody, if you're going to use the roads,
then you have to have
pay.
insurance.
If you're going to use the hospitals at some point, you have to pay.
We've had a lot of transportation analogies today, haven't we? Well, let's move on here down the highway, if it's your call. Another viewer has emailed me and said, hi, my name is Mazda, and I'm a student. I don't have any of the health care or insurance or any benefits. My family doesn't have it either. We're reading these literally as they have been written to us, so you can see that's some of the language and the semantics, especially from someone who is a student here from another country. But he's saying that he has no options whatsoever to get insurance. Should this be a consideration for him?
Well, if he's under 30, which I think that's what it said, there is a catastrophic plan which would cover him for catastrophic injuries. So a lot of young people who are relatively healthy will be looking at that.
They're just going for that one in a million. If a disaster strikes, you would be covered, and keeping your fingers crossed that nothing else bad happens. Okay, and let's go to Clara, who writes, I live in New Jersey. I'm pregnant right now. I do not have insurance. Would Obamacare cover me?
Not enough information to answer that question. I mean, it depends on...
What, you're either pregnant or you're not.
Well, it depends on her income and what she would
Yes.
qualify for or not. We don't know, and we don't know if I assume she's in the private insurance market, but all the tests or complications we were talking about before about income level for the family and all would kick in. You'd have to know that to answer her question.
Okay, so Clara, if you are watching again, then you need to email us with some more information, and I'll pass it along to our experts. They've been very helpful to our past guests and our past questions.
Could I just add one thing
Certainly,
quickly?
quickly.
So an important part of the Affordable Care Act implementation is that the federal government contracts with nonprofit agencies to serve as navigators.
Okay.
And so a lot of the questions you're getting here are questions that individuals could go to these navigation agencies. I believe, and Terry, correct me if I'm wrong, that in the Delaware Valley, the United Way is one of the contractors.
We'll talk more about that. We'll take a break. And when we come back, we'll talk about what you need to know and where you can get resources for help if you're interested in signing up. Stay with us. We're back in just 2 minutes. We are back here on It's Your Call talking once again about Obamacare. We're calling it Obamacare Take 2. Before we go any further, I did want to correct earlier in the show we were talking about whether or not there are religious exemptions, and apparently there are under certain circumstances. So if you're looking into that, you should look at resources, including the healthcare
Healthcare.gov.
website. It'll give you a lot of answers to some of these questions. We were also talking about nonprofits that are helping people like yourselves navigate through this. And we weren't quite sure in this particular area who might be doing it. I know St. Mary is, but there are organizations all around the country that are helping out.
Yes, you can go on to healthcare.gov and they put in your state and they'll give you the name of your navigator. But then there are many not-for-profits like St. Mary. We have 6 centers out in the community where people can walk in because people want sit-down, face-to-face help. They want someone to help them walk through the process. As you can see, it's very complicated.
It certainly is, because the 3 of us are here and I'm still like trying to juggle it a lot in my head. One question I did want to point out though, or one comment that I wanted to point out, is that even though this is getting headlines daily, we've done several shows on it. The talk shows across the country are inundated with this. It's really only affecting about 5%
That's exactly
of the
right.
American population.
That's right. Yeah, we were talking about this at the beginning. So the health insurance in the United States under the Affordable Care Act includes employer coverage, it includes Medicaid expansion, and it includes these exchanges which are geared to serving the 5% of the market that doesn't fall in either of those categories. And I probably should add, I mean, there's another category, veterans have their own health care plan.
And probably problems that are associated along with it. So if someone has watched this show now, what would you want them to take away from it? If they have not yet signed up, perhaps they've tried, perhaps they've gotten that little wheel going around and around and around. What might you want them to what knowledge would you want them to take into approaching Obamacare?
Well, from my perspective, the most important thing is that they need to give the website a second go-round because it's apparently functioning at a relatively high level now. And I think picking up on what Terry said, if they have any questions, they need to find out who the navigator is in their area, because people. You can tell from the response rate on this program, people are genuinely interested in getting insurance. They just want somebody to help them to do it.
And that's exactly what St. Mary is doing in your neighborhood.
Yes.
So what would you want people to take away from this?
I would want them to know that there is still time. They've actually extended the deadline to December 23rd now to get coverage January 1. And again, reach out, try the website, or come and get someone to help you because it is working, and everyone, in my opinion, should be entitled to health care.
Okay, well, thank you very much, Terry. Nice to have you back with us,
you.
Professor. Good to see you
Pleasure.
again. If you were unable to get through and you have questions or comments for our guest, you can email me directly at lynn@lynndoyle.net, and we will forward them to the guests. They've been very good about answering your questions. And of course, after that December 23rd deadline passes, we'll talk about this again on Take 3. We'll see you. Bye-bye.